Recently, I was talking with my uncle, Dr. Michael Foggs, about the novel coronavirus COVID-19. He's a graduate of both Harvard University and Yale University. He's currently residing in Chicago, Illinois. Dr. Foggs is the Chief of Allergy and Immunology at the Advocate Medical Group of Advocate Aurora Healthcare, one of the largest integrated healthcare networks in the United States. He is the past president of the American College of Asthma, Allergy, and Immunology, and is also the chief medical officer of 540 Protection, LLC, a Chicago-based infectious control company. One of the key technologies offered through 540 Protection is a product that we included into a private residential real estate development that we've been working on in the state of Indiana and Los Angeles, California. Dr. Falk shared with me some of the remarkable impact the innovative technology called Multicluster ionization, or MCI, has had recently in light of our global pandemic crisis. I thought the information he shared with me was useful to share with families and business owners and ultimately the general public at large.
Well, thanks, Uncle Michael, for being on the call. I had some questions that I wanted to ask you. Primarily, what is 540 Protection, and how does it work?
Okay, well, our company, as you know, is called 540 Protection LLC, and we are an environmental technology and infection control company. And we came up with the terminology 540 Protection because it relates to a military perspective. So that during war, if a person is in the middle of battle and they're flanked on all sides by military personnel who are covering them in that situation, they have 360 degrees of circumferential coverage. And if they have air coverage also, they have 180 degrees of vertical coverage. You add 360 to 180 and you now have a military term called 540 Protection. So hence the name of our company, 540 Protection. We can protect the atmosphere with regards to indoor space in all directions at all times, 24/7.
Tell me a little bit about how it works, though, the device itself.
Well, what we have is a technology called multi-cluster ionization. There are many forms of ionization, naturally as well as artificial ionization. The artificial ionization that's used in industry is used to help enhance air quality. But most of the artificial ionization that's used as a form of environmental control is unidimensional in that it has limited capacity because one form of ionization is utilized. What we've done is combine two forms of ionization, which have collectively a synergistic effect, which increases the efficacy and efficiency of the technology when it's applied to confined spaces. So it's called multi-cluster ionization, which is the combination of bipolar ionization, as well as other forms of ionization, which are associated with immobilization and destruction of airborne and surface microbial agents ranging from viruses to bacteria to fungi. And it also happens to disintegrate volatile organic compounds, which are responsible for ominous odors, as well as allergens, which are floating around, such as cat dander, dog dander, mold, and if your windows are open, pollen.
So tell me a little bit of how, you told me a little bit about how it works, but why does everybody need this, or why is this needed now?
Well, there's never an argument that can ever be generated against high quality air. And so even before the advent of COVID-19, high quality air has always been a desirable thing. However, the demand for high quality air has not been fully appreciated by the masses, especially the corporate world, as well as the general population, largely because there are other things to think about. But it has been determined by the Environmental Protection Agency and some other agencies that deal with air quality that indoor air pollution is now responsible for more health problems than outdoor air pollution. So that indoor air quality is critically important because what's in the air can have a profound impact on your health. So in the current environment with COVID-19, the primary concern is to minimize one's exposure to that virus, which can be deadly. But the fact of the matter is, there are other viruses that predated COVID-19 that have also caused death, They include the influenza virus, SARS, the Middle Eastern respiratory virus. And so at all times, anywhere in indoor spaces, one is exposed to airborne viruses, airborne bacteria, and in some cases, airborne mold. And in the case of airborne viruses and bacteria, if enough of those microbial agents are inhaled into the respiratory tract system, then one can become gravely ill. And even if one is not gravely ill, one can have a host of symptoms that are induced by inhaling such organisms, which decreases one's quality of life dramatically. With the advent of COVID-19, the entire equation has changed dramatically by virtue of the fact that we now have a mutated virus, which appears to be ubiquitous and which has the ability in the worst case scenario to kill you in large numbers. And also has the ability to induce illness in those who are fortunate enough to survive. So that those individuals who've been on ventilators, in some cases, have permanent lung damage. And that permanent lung damage, in many cases, is superimposed on pre-existing lung diseases such as asthma or COPD. But in other cases, the infection was severe enough to cause permanent scarring of the lungs and fibrosis. And so if you can implement any technology to minimize exposure to any microbial agent which can induce illness, especially in debilitated individuals, such as those at nursing homes, people who have comorbidities such as congestive heart disease, or congestive heart failure, diabetes, kidney disease, respiratory diseases. Their outcomes are collectively poorer than those individuals who don't have those comorbidities. And so now you have to exist in an environment where you carry out your day-to-day activities and functions. You go to the grocery store, you go to church, you go to the theater, you go to the beauty salon, you go to the barber shop, you go to the department store, etc. And when you enter all these places, including your fast food restaurants or your regular restaurants, now the question is lingering over everyone's shoulder as a point of contention as it relates to their risk, is whether or not the COVID virus is still lingering and whether they have sufficient immunity to be able to neutralize it so they don't become ill. So any technology that's cost effective that can be implemented and placed in confined spaces such as restaurants, nursing homes, hospitals, aircraft, in the case of the military, submarines, destroyer ships, tanks, military barracks, or in other cases, quarantine facilities, cruise lines, oil rigs, where they have to be very careful about particulate matter that's floating around. It makes perfect sense to minimize one's risk and increase safety by enhancing the air quality. And you enhance the air quality by eradicating the very agents in question that have the ability to induce illness. In this case, COVID-19, but also influenza, H1N1, as well as any of a variety of other coronaviruses, as well as bacteria. So the superbugs that you hear about in hospitals, where the flesh-eating bacteria, which cause permanent destruction or which are resistant to antibiotics, can be eradicated if they're airborne or on touch surfaces by the implementation of this technology. And so that's why it's so important that a cost-effective technology is implemented. And that's why we've been successful so far in having this technology incorporated into edifices such as medical examiners' offices, as well as prison systems.
So you have proven success rate. One other question though, what is the difference between HEPA and the HEPA filters and these items that you got for 540 protection have?
Well, HEPA stands for high efficiency particulate air filtration. So HEPA is an effective means of enhancing air quality on a limited basis by virtue of the fact that the air filtration system requires that the agent in question come in close enough proximity to the device so that it is trapped by the device. So that if you have a HEPA air filter, air purification system, such as a portable device in the corner of a room or on a shelf, the particulate matter, whether it's viral or whether it's air pollutants or allergens, have to come in sufficient proximity to that device in order to be trapped. So the difference between a HEPA filtration system, which by the way requires filters that must be changed anywhere to every 3 to 6 months based upon the device, and sometimes, if you're lucky, every 12 months, that device is different from multi-cluster ionization, because multi-cluster ionization actually is an active technology as opposed to the HEPA filtration system, which is a passive technology. For example, if I have a mouse in the house and I want to catch it, I can put some cheese on a mouse trap and pray that the mouse comes within sufficient proximity to the cheese to go for it and then get trapped by the mouse. Our technology is equivalent to 10,000 cats chasing the mouse 24/7. And so therefore, the mouse has no opportunity to escape because we're not waiting for the mouse to come in close proximity to the cheese. We're attacking the mouse wherever the mouse is located. So that's the difference between multi-cluster ionization technology and HEPA air filtration systems.
You guys have a peak in demand right now. What are your proven success rate? I mean, what are you seeing now? What's the demand for some of the usage location-wise?
Well, the key demand right now with the COVID-19 crisis is within prison systems. Because, for instance, in the city of Chicago, we have Cook County Prison, and to date, they've had over 300 inmates infected with COVID-19 and close to 200 staff members infected with COVID-19. One of the staff members has died, and 6 of the inmates have died due to COVID-19. The Cook County prison system has 4.5 million square feet. And so within that system, not only do they have to deal with COVID-19, but they also have to deal with influenza infections, which are still prevalent because the flu season is still very active. So that's an example of a place where there's a major demand. In fact, one of the places where we have installed the equipment, which is Kane County Correctional System, the sheriff has pointed out that since our equipment has been installed, there have been 0 cases of COVID-19 infections among the prisoners and among the staff. So we think that the technology is proven in terms of its efficiency and effectiveness. It's not to guarantee that no one would be exposed if this technology is implemented. But if a person, for instance, is on an elevator and sneezes and happens to have COVID-19 infection, and you have anywhere between 5 to 10,000 COVID-19 viruses floating around on that elevator, that number would be promptly reduced in a matter of minutes with this technology operating, as opposed to the absence of this technology, so that, say, X number of floors down or up, the next person gets on the elevator is therefore, by extrapolation, going to be exposed to less concentration of the COVID-19 virus or any other virus or bacterium for that matter. And therefore, the technology is now reducing what we call the bioburden of exposure. And that's important because with COVID-19, it's been proven that it works similar to a toxic agent. It's a dose-dependent phenomenon. If you inhale a high number of COVID-19 viruses, you're going to be much sicker than if you inhale a few number of COVID-19 viruses.
I see. You know, the minority community has been seeing higher exposure or higher COVID reports. I'm wondering, is there something that you would suggest to the minority community to do, or is there something that we need to look at to help curb that?
Well, the traditional explanation for the increased morbidity and mortality of African Americans due to COVID-19 virus is lack of access to health care, health-seeking behaviors, as well as increased prevalence of comorbidities, all of which are true. However, there's a neglected area which may be equally impactful based on some preliminary research and empiric analysis of the population at large. About 80 to 90% of African Americans have a low vitamin D level. They either have vitamin D insufficiency, which means the level is low, but not as low as it could be, or they have vitamin D deficiency, which means it's so low that it's dangerous. And so what has been determined is that unlike any other vitamin, vitamin D is the only vitamin that is not simply a nutrient. It is a hormone, and it governs the immune system. So it's been proven that individuals who have lower levels of vitamin D have higher prevalences of infections, such as influenza, the common cold, acute bronchitis, pneumonia, sinus infections, etc. So therefore, a colleague of mine who's at the University of Chicago has actually published an abstract in the British Medical Journal very recently, demonstrating the mechanism by which vitamin D helps neutralize COVID-19 viruses. And so therefore the speculation is that one of the reasons, and again, emphasis that is only one of the reasons that African Americans may have a poorer outcome as a result of COVID-19 infections may in fact have to do with the fact that their vitamin D levels are quite low.
Mm-hmm.
So it's highly recommended that everyone, including African Americans, get a baseline vitamin D level to see what it is. And if it's low, make sure that vitamin D supplements at the appropriate dose are taken to normalize the vitamin D level, because there's a clear-cut direct correlation that is inverse in relationship between vitamin D levels and prevalence of infection.
Well, I thank you for this information. I think it's good information to have, and obviously from the medical field, you've got it all wrapped up. I don't know that most people have a common working knowledge of everything that's going on and how to prevent or how to keep themselves safe. But I want to thank you for taking the time to share with us, and stay safe.
Well, thank you for the opportunity. It's my pleasure, and keep doing the good things that you're doing, and we will continue to collaborate down the road.
All right. Thanks.